I am Dr. Ram Prahlad, working as a consultant medical oncologist at American Oncology Institute, Guntur. September month is celebrated as Ovarian Cancer Awareness Month. So today I am going to discuss few aspects about the ovarian cancer. So ovarian cancer generally occurs in the elderly age women, the age of more than 50 to 60 years of age. So the symptoms of ovarian cancer are very subtle, like abdomen distension, weakness, malaise. Certain times it can be abnormal uterine bleeding, and vague symptoms like frequency of micturition, constipation, abdomen bloating, which more resembles the acid peptide disease. So generally, when the patient comes with these symptoms, we do an ultrasound abdomen where we are able to detect an ovarian mass lesions, and we do a CA-125, which is one of the tumor marker in case of serous cystadenocarcinoma of ovaries. So when these two markers have been elevated, we try to stage the patient with CECT abdomen and CT chest, where we are able to see that what the stage is. Generally, the most of the patients will lie in the locally advanced or in the advanced stage of the ovarian malignancies. When the patients are landing in the ovarian malignancies in advanced stage, we try to do an ascitic fluid tapping and confirm the patient is having a malignant disorder. And we start with the neoadjuvant chemotherapy with the carboplatin and paclitaxel for 3 cycles, and we do a response assessment after 3 cycles. When the patient is having a very good response, we are sent to a surgical oncological team for doing an interval cytoreduction surgery. And once the surgery is done, we try to give the adjuvant chemotherapy for the management of these cancers. So we have generally ovarian cancer does not have any screening procedure. But in case of high-risk patients, particularly who have BRCA mutations, we try to advise them with the ultrasound abdomen and CA-125 as a screening procedure. So generally, these are the curable malignancies when diagnosed in early stage. But due to lack of awareness, they are being diagnosed in advanced stage and are getting treated as a chronic disease. So my advice is, in the patients of elderly patients, so try to do an ultrasound abdomen and CA-125 on a yearly, so that if they have a family history or they are prone to these malignancies, or can get diagnosed at an early stage and get a proper treatment so that they can get a cure for this disease. Thank you for giving me this opportunity.